Hello.
Yes.
Yeah. Just now I've just started my YouTube live also. So this link has been shared to all the people because we have limit of 100 numbers. So if you want to have this live streaming, then you can use YouTube also.
All right.
I think participants are getting joined slowly. The participants are increasing, I think.
Yeah. Yeah. 2 more minutes. We'll wait and then proceed.
Yeah, yeah.
You're going now?
Yeah. Hello, good evening, everyone. A warm welcome to all the participants for joining us today for this exciting and informative webinar on innovative technologies in speech and language therapy to boost your private practice game. So this is being organized by Telangana Audiologist and Speech Language Pathologists Association and in association with Walnut Early Support. My name is Dr. Arif. I am delighted to be your moderator for this webinar. We are thrilled to have a fantastic lineup of experts in the form of two guest speakers we have today with us who will share their insights and experiences in emerging modern technologies to enhance speech and language practices. Uh, whether you're just starting your practice or looking to take next level, today's discussion is very much important to you. This will be very much valuable things which we are going to share with you people, and also we are going to share the tools which are very much helpful in your private practice, and also there's some great kind of strategies we're going to share through this webinar. Before we begin, I would like to highlight few guidelines. When we start these things, this session is recorded. The whole webinar will be recorded. It will be available for you. Even we have a YouTube live streaming also. That link is also being shared. And through this, both things you can connect to us. And also, I request all the participants who have joined, please mute your mic, and so that you should not distract our speakers. So let's start our first session. Now, to set this stage for today's webinar, now I will not make her wait further. Let's call upon our first guest speaker, Dr. Arpita Chatterjee Shahi. She is going to shed a light on the advances in teletherapy, effective use of rules and norms and technology in delivering speech therapy. Let me briefly introduce about her, what are her achievements, and what she at present what she is doing. She's the director and founder of Divansh Rehab, and also she's the consultant speech language pathologist and research associate at AIMS Rishikesh. And she has the experience of about 14 years of experience after post masters, and she has worked in premier tertiary hospitals like Care Hospital, government organizations, and medical research university. Uh, uh, and also, she has got specialized training in swallowing disorders, that is from Tata Memorial Hospital, Mumbai. And also, she has got a great experience in oromyofunctional therapy, and also she has got training in vestibular assessment and management, that is been taken from Dr. Srinivas Dorasala, Bangalore. And also she has got a great vast cochlear implant training from Mumbai, and she has received some kind of awards, also recognitions from various uh, states and institutes. That is, she has received scholarship from Central Government of India for merit, and also she has received National Women Excellence Award by the National Academy of Art Education, Pune, Maharashtra. So she's also done so many research papers. She has, for that she has received some best scientific paper award in first Sound National Conference in 2018. That is held, or that was held on Amritsar, Punjab. And also she has received some best scientific paper presentations which was held at ISAM Orissa 2024. And also recently she has received best national level SLP award from Telangana audiologist and speech language pathologist. Congratulations, madam. And she did so many publications also. She has about 27 publications, and contributed so many to create, to form so many syllabus for post graduation and graduation students under NSOU. And now I'll not make you further wait for our madam's speak talk. Now I invite our guest speaker, uh, our Arpita Chatterjee madam, to talk on advances in teletherapy and the effective use of rules and effectiveness and use of rules and forms and technology in delivering speech therapy. Happy to hear, madam. I'm going to
Thank you,
share
sir.
the screen. One second, ma'am. I'll make you as a host.
Fatima,
I'm presenting.
parang why cut?
Yeah. Now you can share your screen, madam.
First of all, a very thanks to Telangana Speech and Hearing Association for inviting me for this event. I'm also thankful because I couldn't come in person. I was felicitated with being Best Speech Therapist Award from Telangana Speech and Hearing Association. So overwhelmed, and I would take this opportunity to thank all of you and the jury. Apart from that, I'm also very thankful to Walnut Support. My own colleagues are behind this brainstorming therapy material which has been developed. Today, I'm here to discuss about how we can make our therapy services better for all of us who are into private practices. And even if you're in a hospital setup, you can always inculcate whatever experiences you will gather from today's experiences from our presentations. So I particularly am going to talk about advances in teletherapy, which is, we are going to talk about rules, norms, and technology. More than that, I'm going to share my own experiences, which I have learned through my journey, and hope it will help you also in your practices. So who am I? Why was I called for this session? I am a speech language pathologist with 15 years of experience, and I follow evidence-based research methods in practice. I have been practicing online speech therapy since last 2 years. For this, I have completed e-learning course by Center for Research in Telerehabilitation, University of Queensland, and Speech Pathology and Audiology Department, the Royal Brisbane and Women's Hospital in Queensland, Australia. This happened in long back during COVID times, where I was in a hospital setup and I had to deal with patients who were in a remote area. So before doing anything, I think that we all should get trained in what we are going to do, because this is something which is not traditional. This has to be inculcated, this habit, this practice has to be inculcated. So let me go to a few definitions of how do we define online speech therapy. So telepractice is the delivery of services using telecommunication and internet technology to remotely connect clinicians to clients, other healthcare providers, or educational professionals for screening, assessment, intervention, consultation, and education. Telepractice is an appropriate model for service delivery, and this has been highly advocated by ASHA. Why is it important? Because we are RCI recognized speech therapists. We follow guidelines. We have associations where we are answerable to. Our practices should always follow the guidelines which have been given by our hierarchies. So yes, Asha, I'm hearing some noises in between. If you can control that, please.
Madam, please mute everyone, madam.
Acha, I have to mute, is it?
Yes, yes, you are the host. You can mute everyone.
Yeah, okay. Just a second. Yes, sorry for the disturbance. If you have any question, you please keep it in the voice box, chat box. I'm sorry. I can answer you that after the session. Am I audible now? Somebody said voice is a bit low.
No, audible, madam. Audible, ma'am. You can.
Thank you so much. So telepractice is an appropriate model of service delivery, and this has been well advocated by ASHA. It is a primary mode of service delivery where you can use only online speech therapy also, or you can supplement with your offline therapy as well. Why am I talking? Why am I interested as a speech language pathologist? Is that I myself has faced many obstacles in service delivery, be it because of the patients who were far away and couldn't avail, because of my own personal history where I had to travel from one place to another because of shifting of jobs. So it is a very good option which I was initially skeptical, but I studied, I got trained, and now I am actively using it. So that's why I want to share with you, because this is something which is actually going to help you in your private practices as well. And it got stuck in between. Just a second, please. Yeah. So who is advocating? As I said, I believe, and we all of us who are educated and in audiology, and we have degree and we are practicing with the RCI, registration, we all have the onus to follow guidelines, as I said. So it is advocated, supported, and affiliated by our professional bodies. So Isha is there, Asha is there. Both have advocated that yes, you can use is at medium of service delivery. So if you can go to Isha guidelines, I have kept it here. I can also share with TSLPA organizers so that they can share it with you for ready reference, where there is 37 pages of draft which has been made and circulated long back in 2000 when all this started, when COVID time started under the leadership of Dr. Indranil Chatterjee. This draft was done. So it has all the guidelines very well written, how you can use, what are to be used, what are the equipments to be used, what are the ethical aspects you need to be aware of, what are some of the therapy websites, softwares, websites along with it where you can use in your practices. I will also ask, because I personally know many of my fellow colleagues who have already or in a process of developing materials. They are using indigenous materials. I'm so happy and glad that they're doing this. So kindly share with Isha website or other form of association websites also, because it becomes a ready reference where they can avail and has a higher visibility for clinicians like us. Yeah, so these are, if you go through it, it's a long one, but it's a beautifully well drafted written guidelines. You can follow this. I'm not going into very detail. That's what I said. In very limited time, I can only share what experiences I have received. And I think that would be beneficial for you also. So this is ASHA guidelines. So one more thing, whether it is offline, whether it is online, it is very important to understand what is evidence-based practice. Evidence-based practice means which has been written and documented well in literature. So if I'm doing a therapy technique or I'm using a diagnostic test of battery, I also should be knowing that whether this is well documented in the literature. So what I follow in practice, and I want all of you to also practice who are unheard. Many people might have already known, but for the unheard, please see how I follow. So I go to ASHA website, okay? So there is something called practice portal. So if I have to search for anything like telepractice, I wanted to see whether it is evidence-based. So I have typed telepractice and I got so much literature on this, right? Even if you want to go to any, any particular topic, like, let me just show you. Is it visible?
Your screen is not moving, madam.
I have shared, 1 second. Just,
You can, yeah,
I'll reshare it.
yeah, please.
Yeah.
Yeah,
visible?
now it is getting open.
Yes. So when I go to ASHA website, I can see practice portal, right? So yes. Yeah. So when I go to clinical topics, I can see number of disorders. So whatever is my client, it might be autism spectrum disorder, apraxia of speech. I can just click on it and I can see what latest information is there about the certain disorder. I have opened autism spectrum disorder because mostly I get the query whether you can deal with autism, kids who have autism through online medium. So that's one of the topics which is usually encountered. So you go to ASD, you see all this, you have treatment protocol also, what to use, when to use. So you can directly go there, you have evidence maps. Yeah. So in evidence map, again, I want to see autism. So what treatment I'm going to use, whether it is evidence-based, how do I convince? And gone are the days when the parents were not aware. Now they are Google parents. So they are already tried and tested many things and what is working, what is not working. They will only tell you, my child has autism, but I think ADHD also. So they already have completed the diagnosis before they have come to you. So you have to be very careful. What treatment are you giving? How many percentage of patients has actually improved with that particular therapy? That practice has to come. That practice has to come. So if you see, if I'm showing you, so there are systematic reviews. So if you people who have done researches will know that this is the highest form of research where you have collected information of many researches and you get to a particular conclusions. Like if there is a study called Effects of Augmented Reality on Social Skills in Children with Autism Diagnosis. You can directly go to the conclusion and see what is the conclusion, right? If you have time, you can read the entire article. If you do not, you can directly go to the conclusion and see whether it's working or whether it is not working. So that helps a lot. You know already you have documented researches which supports your findings. You can use that in the diagnosis and you can as well use your treatment as well. So that's what I wanted to say. Do everything which is research based. Let me go back to my slides, please. Yeah. So there I found that yes, Asha has given beautiful guidelines, very constructive guidelines where you can use it. But those were based on their norms. Even Isha has adapted it. So it's better to go through Isha. It is much more easier to understand. It is Indian based if you are a practitioner who is based in India, or you can follow Asha guidelines as well. Yeah, so Asha has adopted the term telepractice. Why? But because earlier it was only telehealth, which was a common term, where there was diagnosis being done in remote areas. But that has been adapted by Asha, and various names like teleaudiology, telespeech, speech teletherapy is used unanimously. So you can use either telerehabilitation, it's a generic term, or you can use telepractice also. Online speech therapy is more of for a professional, it is telepractice. Why it should be advocated? See, there was a earnest need. We all know post-COVID, there was a huge change in the entire dynamics of therapy, and our patients who are into rehabilitation need day-to-day access to therapy. We know how much hamper even one day of absence of therapy makes. So then came this, entire phenomena of doing it online. So, but it didn't stop there. We are out of COVID now, thankfully, but still it is being used. Why it is being used? Because the good things have been, taken from us. So there was a stark contrast in demand and capacity, in our country. That still exists in audiology and speech language pathology services, which are of no exception. In healthcare, one is to if you see how many speech therapists are there, the demand is huge. You can actually not meet up to that demand. Okay. So audiology and speech language pathology services are no exception. The technological solution also provides a means to address the rehabilitation needs of these patients. The potential for audiologists and speech language pathologists to bridge the gap where the patient actually doesn't turn up because of logistic reason, because of time reason, because of monetary issues. Everything can be, kind of adjusted if you're also using teletherapy as a part of your speech therapy delivery service. So why is it convenient? Because more appointment availability can be made. End of the day, we all agree that our services are a bit costlier for a country like India, where even we are trying to meet our day-to-day needs. A daily wages worker, it's very difficult to bring the child for therapy every day. From your, understanding from your researches that you need extensive speech therapy for at least 5 days a week for 45 minutes of session. So this is dosage which has been governed. But you settle down to, okay, if you cannot manage for 5 days, come for at least 1 day, come for at least 2 days. You kind of manage this, but at the end of the day, this is not going to work. But in that case, if you actually give hybrid, where you have maybe after 15 days, you can call the patient or client to your clinic, and the rest of the time they can avail online speech therapy, you will see remarkable changes in your service delivery. They will come more to you. They will be more attached to you because they are not going anywhere else. They want you, but because of their certain constraints, they're not continuing with you. Even for females who goes for maternity leave, I have seen myself, I have seen my fellow colleagues, they absolutely lose contact of their career. So this is a very good medium for my fellow females or a person who are relocating a lot. It's convenient for both the therapist as well as the patient. Accessibility, it is easier to access for those with limited mobility. We know patients, we have stroke patients, we have, cerebral palsy, patients who have cerebral palsy or limited mobility. When they grow up, when their child, still the parents can carry them on the lap and they bring. Adult patients have you actually dealt with? The problem is accessibility. We are not in a state where we can give barrier-free environment to everybody. So at least you can use online medium or telespeech therapy medium for them to get more accessibility for service delivery. Okay. Next is affordability, often costs less than traditional in-office therapy. See, if you are if you are just started up or you are just fresher, you need some fund to build a clinic. We all know that. You do not have adequate material. You do not have that infrastructures. to be made. So what you can do, as if you have done bachelor's or master's, you already have a laptop, you already have system, you can start from scratches. You can start from scratches and then slowly build up your infrastructure. So that wise it is, affordability is more. In terms of patients, the traveling cost is taken care of. The wages care is taken care of. So that again is economically beneficial for both of you. Anonymity. I will share one of my story. That's what I said. Experiences make you wiser. So one of my, I attended one of the PTM of my child. So what happened? One of the teachers there, when I introduced, while talking only, while conversing, she came to know I'm a speech therapist. So she she said, ma'am, I need speech therapy for my child. But I want to access it because she is definitely in need of speech therapy. I said, well, good, ma'am, please bring her to the clinic. But she said, ma'am, where you stay, everybody knows me. Even your child knows me. So what will happen is everybody will know that she is into some kind of therapy. So I do not want to make people judge for my daughter. See, immediately, impulsively, you would think that this is wrong. What is there? If the child has disability, you should face it. But we have to be very wise in understanding, and with that, we have to respect professional boundaries. There are people who do not want to come in front and avail therapy. So that in that circumstance, you can use online speech therapy where the anonymity is still maintained and the child receives speech and language therapy, or whoever is an adult or a geriatric patient, everybody can use, and the anonymity is still maintained. So we have to be non-judgmental and rather create a more conducible environment. Yeah, so let's come to a bit of technicalities. Modes of service delivery in online speech therapy. One is synchronous, like me and you doing this event today. This online webinar today. This is synchronous, where I am talking to you, you are listening to me, and both of us can communicate at the same time. This is synchronous. So you have a system, you log into Zoom or you log into any other online speech therapy system, online platform, and the child sits, the mother sits, or the patient sits, and you can have face-to-face conversation through video conferencing, teleconferencing mode, right? So this is synchronous. This is happening at the real time. Then is asynchronous, where you can save your videos, or you digitally save their videos, or you demonstrating the exercises and send them. Hybrid is where you use both of them. You are doing a one-to-one also, and you are saving it for future purpose. Very nicely today, TSLPA Association has done what? They're doing a synchronous also, and they're saving it for further usage, because we are humans, we have limited memory. So even if somebody has to go to a ready reference, they can always go back and see through the YouTube medium also. While giving therapy, many a times we hand over pamphlets also. This is the same thing. You can immediately have synchronous also. You can record and send them also. So what is better? You are going to use it. So you have to decide what is best going to work for your child or client. Yeah, so as I said, it is research-based. Yes, it is research-based. It has been used in developmental disabilities. As I say, systematic review means you can be well assured that across the countries, many speech therapists have advocated that it is equally good. It is equally good. It's not a replacement. I'm not saying that it's a replacement, but it is equally good as one-to-one or face-to-face speech therapy. Yeah, so these are some of the findings which are there. So you can always go, as I've showed you in the ASHA website portal, you can always go and visit the systematic review. Please read through. Please read through, because once you comment on something, you really need to yourself be sure of that. Yeah. So even autism spectrum disorder adolescents, if they are there, you can use hybrid system for them as well. So while doing that, when I said I was the one who was very skeptical of using, because I was trained in a particular way. I have graduated long back. So I was the one who could only understand one-to-one speech therapy, right? So, but eventually, because of the circumstances, I started online speech therapy. So there were a few questions which I had in mind. So I found the questions, I found the answers to it, and I want to share that as well. So online speech therapy is beneficial only for a few conditions. That was the first question I had in mind. Okay, fine. If it is attention deficit hyperactivity disorder, then what? Autism, then what? Okay, fine. If it is articulation, I can do. Okay, fine. That is fine. But what about if the child is having behavioral issues? He or she will not even sit for my therapy. They don't even sit for the offline therapy, leave alone online therapy. So is it beneficial for all? Literature says, don't believe my words, literature says, yes, it can be beneficial for all the patients, irrespective of the diagnosis. The scope of practice is increasing. And as I said, when you refer to the guidelines, you will see that there are many, generic guidelines. We as audiologists and speech language pathologists have to document our understanding of these experiences based on specific disorders. Me at AIIMS Rishikesh are developing telespeech therapy for cleft palate patients. Exclusively, the guidelines are being made. I would request my fellow speech therapists to start online speech therapy. See what problems are you facing and how you are addressing those problems, and start documenting based on diagnosis rather than having a generic guidelines. Yeah. So next is online speech therapy is less personal and individualized. Question doesn't arise. You are the same speech therapist who has been trained. You well understand that all the children or your patients are different from each other. So your therapy plan, your diagnosis will always, your diagnostic criteria, your assessment plans will always differ from individual to individual. You are well trained with that. So because of the medium, because it is online, it will not change. Complex technology. See, as I've shared, you have ISHA guidelines to what to use, what not to use. I will specifically talk about how I addressed it. So I already have a laptop. So all of you must be having that. Why laptop? Because many times it helps when you're sharing many things together, or in between. If you only use through your phones, what happens if you get a call in between? Then you get disconnection. So avoid that. Use laptops. Okay. You need the patients need a LCD which can be connected to your system. Why? Because that gives a larger visibility. We speech therapists talk from our body language. So our lips should be visible, our hands should be visible, our non-verbal expressions means a lot. So it's better to ask the parents to have a connectivity of a LCD. If not, I know many will be asking, madam, they are very poor, they can't afford that. Then leave it. See, you always have to understand that whatever best can be used from the available resources, you are an expert for that. So you have to use your own, methodology to address your patients. If it is there, well and good. If not, still go ahead with a normal smartphone, right? And if you're using, if I have faced, because there are a lot of rural patients who do not even have access to this thing. They do not have access to even smartphones. They're using very basic phones. In that case, either I go for hybrid, I give a home plan, or I give a I call over, and I know it is not exclusively telespeech therapy, but I call and tell them what to do. At least it is better. Don't you think that it is at least better than not addressing the child at all, right? So no complex technology needs are there. Only a good Wi-Fi connection needs to be there, as we are all aware. And even if you talk about the parents, they are very much well aware post the COVID guidelines. They are much well aware how to use it. If they are not, then please give a demo session for them to understand. I always prefer giving a free demo session. You know why? Because in that day would be an exemplary day, that they will also understand what is required, and you will also understand whether you will be able to fulfill the needs of the clients, right? Rather than stretching it and banging your head in sessions one again and again, give a demo in the first session, see what is there, how well you can organize the sessions, and then go ahead, right? and you need a you need an inverter, or you need a without power breakage connection. So that minimal connection system has to be there. So online speech therapy makes it harder for parents and caregivers to know how kids are doing in therapy? No, rather it is much more better, because see, when you are into online speech therapy or tele-speech therapy, it is actually the parent taking the vital part of letting the child sit in a proper position, arranging the entire room. These are all parents' responsibility, and this has to be shared. This information has to be shared before even if you start the speech therapy. So they were well aware. And in the Isha guidelines, you will get a documentation where they have written a consent form. Very important, because this is online therapy also or offline therapy also. Get a consent. These are to be used. You can modify that and get a signed, so that they are also aware how am I going to arrange my speech therapy sessions so that effectively it can be used. Online speech therapy might expose kids to danger of the internet and exposure of screen time. This is a very valid question. This was there in my mind right from the first day, and I think everyone will have that, and you will face the parents' question also. Ma'am, you only are saying that don't expose the child to screen, and you only are saying that come, let's give speech therapy. So what happens is online speech therapy, there is a guidelines given by American Ophthalmologist Association. Okay. Few things you cannot take away from the child. They are anyways getting exposed to the screen time. What guidelines they have actually given is 20-20-20, means 20 minutes of exposure, and then 20 meters away the child should be for 20 seconds. And then again the child can sit and enjoy the session. This is the guidelines. But what I prefer, because it is usually 45 minutes, I prefer doing an activity, finishing that activity, and my activities are usually for a short duration. You also use that. You have to load your, divide your therapy sessions, as in there are a lot of one-to-one interactive and well-designed therapy activities, so that the child does not get bored. If you are saying the child is getting bored, somewhere we are lacking. We have not designed our therapy plan well. Once we leave our college, we have a very good habit of leaving everything we have learned and do it very fast. Please don't do that. If there's a purpose of everything, that documentation, what are you going to do after one after the other, that has to be designed well enough before the therapy. So how are you going to do that? How are you going to create so many therapy materials, or you are going to design so many therapy goals? I'll talk about that. So one more thing I wanted to say. So from my experience, what I do is, once the activity is over, I ask the child, go get up and drink some water. So reflexively, whenever you drink water, your eyes closes, if you have noticed. So that's a reflex, so that it does not, you don't overpour on it yourself. So what happens, that child automatically blinks or closes his eyes for some time, and he is hydrated, well hydrated. He is all set, and he can come back. And in that time, you can also communicate, like go, get up, get water, drink water. So a lot of communication also happening. The child is also getting, time out. And then the child is also getting hydrated, all set, the child can come back. So that's how we deal with the screen time. Okay. So remote administration of speech and language assessment might compromise with the validity of the test. No, again, if you are doing any diagnostic test materials, so you are availing that. You can use the pictures. Very luckily, I have been practicing since 14 years. I wanted to tell you that it was so hard to get indigenous materials which has been designed by speech language pathologists, where you can actually access and administer those tests. I'm so happy my fellow colleagues are developing test materials. They're developing therapy materials. Earlier, we used to only use books or some educational materials, which actually does not follow the hierarchy of speech therapy. You are from the same background, you'll understand. So after this, what next? I will get saturated, but now things are very accessible to us. Use those materials which have research based, which are actually developed by some speech language pathologists, so that has more validity. Apart from what Asha is saying, Isha is saying, you are the judge for your own therapy. So use those materials where you can identify more with. Use that, order that, use that, and then see whether it is applicable for your setting or not, and then only believe it. So what about oral motor evaluations? So there are some, I will say barriers, because there are oral motor evaluations which I've done very effectively, because I said I have been trained there. So from Queensland, so I have seen how they are doing in dysphagia patients. So I am trained. So I'll request my fellow clinicians also to get trained in how to do it through telepractice. And apart from that, I'll share a trick. What I do is I ask the mother to flash a light on the oral cavity and say the child, child or client, patient, whatever. So whenever they open their mouth wide open and say, what happens? I can see the entire length of the palate. I can see the soft palate movement. I can see his lip closure. That is a maximum I can do. I can ask also to drink, child to drink also. I can do various tests while doing the oral motor evaluations. If in case I'm not happy, with the oral motor, I still feel that I could not perform it very well. After a few therapies in my articulation speech therapy, it was a cleft child. So what happened, I started giving therapy. The child developed very good language. Speech, I saw the child is not producing velar sounds. So I told us there's something wrong. I tried all the traditional speech therapy methods. I said, please bring the child to clinic. I evaluated and I saw that child is having a habit of tongue thrust because of bottle feeding and all. So because of the tongue thrust, so I said, until and unless I address the tongue thrust, I am not going to get a good articulation. So there, sometimes you have to judge that only online speech therapy is not going to work. Tell them to come for one speech therapy session, assess and send them back. You are not going to lose the client. They are they will very happily come to you for the evaluations also. So you can do that. You can start with the evaluation and then start the speech therapy, or in between also, if you feel there is some barrier, you can do the evaluation online also, offline also. Then online speech therapy can be done with minimum investment. This is a myth, and I request all of you that you will face such connotations from parents that, ma'am, it's online only, reduce the price. If you're charging, for example, you're charging 700, 500, they will say, ma'am, 300 mein kar dijiye. Please do it in 300 because it's online only. Please be very sure you are the investment they are investing on. You are the investment who has spent half of their lives getting trained, leave alone being a bachelor and leave alone being a master's PhD. We at this age are also getting trained on and off, so that we are getting more skilled in our service delivery. So there is I am the investment. The online or offline medium is not the investment. So do not reduce the amount. Please do not. That will take away the gravity of the situation. So please maintain whatever you think is feasible for you also, for the patient also. That is your decision. But do not, decrease the charges because it is online. That is one of my requests. So it is not minimum investment. You have to have a Wi-Fi investment. You have to have various therapy materials to be procured. You have to have many, power supply backup is there. And apart from what I have said, you are the investment and you are worth of it. So do not even disagree with that, or do not adjust. This is again a very frequent questions to be asked, which is, how will I make the child sit for the session? See, it is as equally difficult to make a child for the session sit as in offline therapy. It is same in online therapy as well. Your skill and use yourself as a therapy material. Apart from the therapy materials you are using, which are brilliantly being made, you use walnut, which has been developed, and the next speaker is going to talk about it. You can avail that also. You can use whatever therapy material you want to, what is best suited to you. That is one thing. Secondly, you yourself are a therapy material. Aren't we all trained in that? Your voice, your modulations, your face, your way of talking, your expressions, everything matters for the child to sit. Next thing, please allow the child to settle down. This is one thing I want to tell you. Environmental modifications. What do I mean by that? See, in online speech therapy, what happens the first day when you give speech therapy, what I have experienced, the mother will hold a phone like this and hello ma'am, how are you? And then she will also run and the child will also run. Both will be running with the mobile phone in hand. So that becomes very funny, and at the times you become very irritated also. What is all happening? But it is not the fault of the parents. It is actually, we have to make them understand how to address the session. So what I do is tell them that this is speech therapy. So ask the child to get ready. Maybe they can dress up, like they wear proper shirt, pants, come, sit, tell them, get their toilet, susu potty, everything done, and then sit. And then they tell them that this ma'am is going to come and she's going to take the session, sit there. You have to create that environment. Close the door so that he can't run away. Close the door and create the entire clinical setup as one. It is not only about only chair and table. You understand my point? That's not laptop. Even you can use your own therapy material so that the child can see and he can point out, ma'am, that toy, this toy. If you can see, can you see this? So I've arranged it this way so that the child can, ask for it also. So he's more engaged with the session. He doesn't feel that it is online. So that discipline has to be made by you and then demonstrated to the parent also. And don't be late. That's a very bad thing. You have to be on time so that your parents are also on time. Things to take care during session. I will share this. What I do is usually I tell, if the child is very small, I tell them kindly sit in the floor and place the screen as such that I can see the child playing, right? So the child should not be in the lap. The child should be in the floor with the toys. You instruct and the parent also has to take care what needs to be done next. Okay. So this is how we do for small children, and for the older ones, you can ask for sitting arrangement where you can see the workplace area. This is one place where I had to struggle a lot. What happens is the parent will only show the child's face. Now, what am I going to do with that? I need to see his hands. I need to see how he's moving the toys. So tell them to place the screen as such. They can use another table to do that. And they can use the amplifiers also so that my voice is loud enough for the child. And then ask them to do it. So that's the environment. It's not environmental modification. If you make it, will make a huge difference in your speech therapy. So choose your resources wisely. See what has been developed by your fellow, speech therapists, because they understand it more. They know what is the hierarchy of the language, and that you will feel the difference once you use whatever is applicable, is available freely in the website, and whenever you use specifically designed speech therapy materials, you will see how your services are different. And mutual respect during the session. You also don't run away in between. Do not attend a phone call, and share that discipline with the parents as well. Yeah, one more thing, artificial intelligence, which is very new to this, arena where we are using speech and hearing. I am not an expert, but this is something I've started using. I'm trying to understand it. I want you also to try it. It is very easy. I'm not advocating this because it is still under research, but you use it. I'll tell you, just learn from it. If you can add on to the information. I'll just show you once. Let me share my screen, what I do. Two seconds, please. Yeah. Is the chat GPT opening?
It's visible, madam.
Yeah. So chat GPT, we are all aware that this is something which has been very famous in the market. So it has its own risk. So, but it will help you. That's what I wanted to share. So go to the message and type speech therapy lesson plan. As I told you in the beginning of the session, sometimes we get saturated. What needs to be used? Sometimes we do not have ready references. This is not a very ideal way to use, but I'll just share because sometimes this helps. Especially for the beginners, this helps. Yeah. So if I write that, see, they have given short-term goal, materials, warm-up activity. I hope I had this when I was a student. I could simply copy this. Yeah. So introduction, main activity. So you will get number of activities like this. Yeah. So you can type and see like this. This is artificial intelligence based on few words. They target words, they frame whatever is there. You are well, educated and trained to understand what will work and what will not. But as I said, you have to be ready with many lesson plans, many speech activities. This is going to help you. And apart from that, in Isha website also, where the paper draft I have referred, they have given many websites and many therapy materials which you can access for online speech therapy. Okay. Yeah. So that finishes my presentation. Before I thank, I would be very happy if you can ask me questions so that even I can understand what are the barriers you are facing and whatever experiences I have, I might share. Should I unmute or?
Yeah, I request you, madam. I request you to make me as a host so that I'll continue with the further presentations and further talks. And first of all, I would like to thank you, madam, for giving a valuable time and explaining about the difference between the traditional therapy and also the teletherapy, uh, and also explaining about what are the tools required for teletherapy and what are the advantages we have using and what are the things we have to uh, put this in consideration, and also highlighting some guidelines which are very important for us, and also explaining about the use of chat GPT, that is AI. Yeah, I think many of the youngsters that are using this nowadays, I think are during our bachelor's days, I think we did not have this. We missed this anyhow, but this is very useful, but it has some disadvantages also. So, okay, thank you so much, ma'am, for and also explaining about the major thing like CAAA. This is like convenience and accessibility and affordability and anonymity. These four things are very important in teletherapy. Thank you so much, ma'am, for giving your valuable time. And I request all our participants, if you have any question, please you can ask our guest speaker is online. She can answer you. Please, if you have any questions, you can put this questions into the chat box. I'll direct you. I'll directly your question to madam.
Dr. Arifji, there are some questions in the chat box already.
Yeah, I'll just go through this 1 second. Yeah, there is a question from Diva Prakash. Madam, how to
Yes.
improve eye contact during an online session?
Yes. See, eye contact is something where you need a joint attention. From the point of view of eye contact, you want joint attention. The child sees, look at you. In the initial session, as I told you, it is as, am I audible? Yeah.
Yes, ma'am, audible.
It is as difficult or as easy as dealing with your children who are coming to you offline. So what you in online speech therapy, only thing is use your voice a lot. Okay, you can use your modulations a lot. I have started using, I'm so sorry to making it a bit informal, that I have started using lipsticks. You know why? Because that will focus, because we are speech language pathologists. I need my child to see my lips moving, my tongue moving. So if I give a blank, you know, visibility, then they can't make out. For the male clinicians, I would request you to trim your beards also, so that it is more, your visibility is much more. That is one thing. You can use hand toys. Okay, hand toys like puppets are there. Then therapy materials are there, which will engage the child more. The next session will deal with that. What are the therapy materials which you can use for attention seeking? Then there you have to plan your session. You have to understand what the child likes, what kind of sounds the child likes. So many a times when he is drifting here and there, I said, lip trill can be used. This can be used. We are all trained in all this, so it is as similar. Please do not have that notion in mind that it will be different. So the child will eventually look at you, and it will not happen in a day or two. With children, it differs. Many a times, it is actually easier to give online speech therapy because the child is already used to screen. So that again is depends on your skill, how you take the attention of the child. And next, give breaks. That is where we falter. Do not extend. If you are seeing that the child is visibly not attending, let him go. And that's what I said. Let him be in the floor rather than on the chair table. Let him freely play. In between, you start giving commands, and the parents will help you in doing that. Did that answer?
Yeah, well, I think you have cleared those answers. I think as you're trying to say, voice is our signature. So with voice and also with using some kind of attractive materials and with our facial expressions and using some, so
Yep.
we can gain the attention from the child. So thank you so much, madam, for the valuable answer. And we have one more question from second. Nitina Alice, she's asking, how do we instruct about oromotor exercises? And she's saying that, should we explain and reveal in detail what
Yeah, please.
what if parents are not doing correctly in online?
Excellent question.
Yeah.
This I have learned from my experience. Excellent question. Because even in your day-to-day practice, you will see, you will be explaining nicely to the patient, but they will forget everything. Yeah, that's very natural because we know the science behind it. We have studied of it. We are doing it on a day-to-day basis. We are our hands-on are very well fixed. So what happens from the patient's point of view, what you can do, what I do, I have developed, I ask my child, I have a son, and he's readily happy to volunteer. So what I do is for the first session, I let him sit in the session. I ask his permission. If he's giving permission, yes, mama, I'm okay. Then I say, okay, please come. So I have patients from UK, USA, everywhere. So this is one thing I need to address very regularly because I can't call them in between to demonstrate. So what I do is get a model, preferably a child, because then if it is a child, they enjoy. This is not a task for them. They feel that is a play. Okay, that Anna is doing or that boy is doing, then this is okay for me also. Okay, so and then demonstrate. Tell them to record the session. You record the session if they are technologically not so apt, and then save it and send them. That's what we call hybrid session, where you're doing synchronous and asynchronous sessions together. Whether they are doing correctly, tell them to record while doing the activity and send them to you so that you also know how it is being conducted. And end of the day, if the child is improving, definitely it's working.
Yeah, I think she got the answer. Thank you, madam. And we have one more question from Ragini. She's asking, do we have any apps to use on screen for kids?
Yeah, there are many apps which are there. As I told you, in Isha, you will find diagnostic apps also, and you will find therapy apps also. But what I wanted to emphasize is understand what is the need of your child. Many app-based therapies are one-sided, where the therapists actually do not have a control.
Right.
The child is only accessing. They
Mm.
are only saying yes, no, and then it is totally out of your control. Many a times, as speech language pathologists, you understand that
Mm.
in that particular goal also, sometimes if my child is not actually saying the entire word, I am happy, that he has actually produced something. So that is called emergent phase, if you understand, right? So there's an emergent phase and there's a stability phase. So in that emergent phase, you are still happy. So you will consider, let me give him full marks for this. So those app which gives you the access to have the control with you, let
Right.
the child perform, but you should have the access. You use that.
Right,
I
ma'am.
think the next session will make things more clearer.
Yeah. I think same thing like, in hearing aids also we have like counter hearing aids, like now they're buying directly through, without involvement of an audio. That is really going bad. So the same way here,
True.
with the facilitator, like, with the speech therapist help, the therapy should go on. Without the speech
True.
therapist, so
Yeah.
that is not a good sign. Thank you, madam, for that wonderful answer. Now let's move on to one more question, ma'am. We have a question from Lekshana. What she's asking is how to assess oro muscle tonicity through online, and how to carry out, 1 second, how to carry out the online session if the child is over obsessed with the screen.
Okay, so two different questions. Let me address the first one first. So oral motor tone is something where you will have a problem. But you can also look into some other features like drooping of of the lips of the client, or you can have fasciculations to see, or you can ask a child to chew and you can observe. See, I'm very close to you. So if I'm chewing, you can ask the mother to feed the child on the right side and then left side, and then see, you can see, perform, let the mother perform while you are doing it on the model and see. That's one way to look into it. If you have absolutely no access to the patient cannot come to you. That's what I'm saying. If the patient has a provision to come to you once or thrice in a month, please finish your assessment first and then start your speech therapy online. If not, then you have to settle down. Even the patients are informed. In that case, you have to definitely inform that I think I'm not very sure the tone. But if I can see both the lips closure very well, if I can see the intraoral muscles, intraoral pressure developed within the blowing activities, in the sucking activities, everything is fine, then at least you're rest assured. So make maximal utilization of whatever resources is available.
Okay. Thank you,
And
madam.
next question was
Yeah, it is about how to carry out the online session if the child is over obsessed with the screen.
Yeah.
Over obsessed with the screen.
See, that's what I told in between, that you cannot take away. He's anyways over obsessed with the screen, right? That's one part to look into. Over obsessed means what? It is a one-way communication which is happening, where the child is alone playing, and only one way there is a communication. But this is an educational learning environment which is taking place. You have to understand and you have to counsel the same to the parent as well. So you have to definitely make it a routine that only during the online speech therapy, the child is going to sit with the laptop or whatever is the medium. Ideally, they ask the patient to have the control of the laptop. The mother can have the control and play it on TV so that the child cannot fidget with it, right? And cannot just keep, juggling from here to there and cannot have the access. So once it is done, shut off. This will take some time to understand. Even if you ask the parents completely stop screen, hardly any parent are able to do. The moment the child does not eat, they will go and start doing the same. At least this is a learning, medium which is happening. So once you counsel that please use it during only the speech therapy session, which is 45 minutes in a day. You can be rest assured. Even American, association has said if the child is not less than 2 years, you can still go on with the online speech therapy.
Right. I think we have a few more questions, madam. Let's move
Do
on
we
to
have
one more
time?
Yeah, we have time, ma'am, no problem.
Okay.
Because let's respect our participants,
Yes, please,
whatever
please.
doubts they have, let's clarify. We have put it as 2 hours because we have 1 more hour to go. So we have 2 more sessions, I think. So let's try to close this as early as possible.
I'm happy to see so much engagement. Very nice. Thank you.
Yeah, because they clearly understood, and also it's a very hot topic nowadays. Many the speech therapists practicing this, so that's the reason why they're asking many questions. There is a question from Shruti Patil. She's asking that can we develop a platform which would help us with a good material and standardized for online?
Yes, it's a need of the hour. So
Yeah.
that's what I requested. Even TSLPA can take over. They're such a active association where and we all are there in the association. So whatever you have developed, when I talk to, see, I'm an editor of a certain journal, right? So when I say to my fellow clinician that have you developed something, let's publish it. He said, no, we are so busy in giving therapy that we are not developing anything. We have developed, but we do not have time to document. See, please make it a habit. It doesn't, it is no rocket science to document. We have been trained in that. Please do publish and get associated with the association. They will help you to have everything under one roof so that we can all access. We are not even aware that our fellow, my juniors, one of my juniors, Anima is there, Pragati ma'am is there. There's Bloom speech also. They have developed. So I'm lucky that we could associate and I am aware. So I would request Telangana Association also, please do, encourage such, events where we can just, even if it is not published,
Sure,
with
ma'am.
permission, maybe we can access your sites. That's a
Sure,
good
ma'am.
point.
Our TESELPA president is very active in these kind of activities. Definitely,
Yes,
I'll
yes.
convey this. I think he's online. He's listening to your words. Surely we'll work on this, ma'am.
Yes.
Yeah, I think there is one more question from the same. I think she has asked this question earlier also. How do we instruct about oromotor exercises? Should we explain and reveal in detail? Sorry, I think this question we have finished with. There is a question from Steffi Annette Abraham.
Yeah.
Is asking, can you suggest some app which you are using?
Yeah, I am using I'm using Walnut, which is the next presentation. I'm also using a few, hard copies also. So there are, please don't go by my words. You please see whatever is available, what suits your clientele, what suits your way of giving therapy. And don't please go into free speech therapies. They do not work because they are like 1 or 2 sessions and then you get saturated. So whatever has been documented, please use that.
Yeah, Dr. Pragati madam already shared some website address. Please go on to that. It is in the
Yeah.
chat box.
Please feel share to, if you are done any work, this is a platform, please share.
Yeah, and also there is one more question, madam. This is from Arshia Siddiqui. She's asking, we cannot use tools online sessions. How do we ask the parents for using tools?
Which kind of tools are you talking about? Test tools you are asking?
I
You are
don't know
not
what
asking the patient to.
I think
mean,
she has not specified the tools what she's talking about. I think she's asking about the softwares which we are using. We are not capable of using those, and how can a parent can use that? Maybe that.
Get yourself trained. People who have developed are more than happy to train you. So once you are trained, train the patients. That's what I said, that use the demo sessions. So once they are accustomed with how to use it, they will be able to use it nicely. This
Yes,
is
ma'am.
not rocket science. See, every, industry who are into commercialization understand that it has to be very user friendly. So there
Yes,
is no
yes.
rocket science. So they
Right.
have developed, get trained.
Yes. Now even patients like kids are using different apps.
They
Yes.
even the
They're very
patient
smart
doesn't
enough
know,
now.
the child will definitely know how to use. That's true.
Yeah. And there is
Shall I
one more.
say that Walnut Early Supports has ample materials actually. Once they open that website, walnutearlysupports.com, they'll see that we have specific modules with innumerous number of activities available. If you are unable to use it, please feel free to send us an email. We will give you demo and train you how to use it in online sessions, as well as how to use it in in-person therapy also, offline in your clinic.
Do you have any video tutorials to how to use that? Like I think
Yes,
you
we
have
have
one.
that also. If people need it, please write to us. We will share with you. We'll happy to share with you all.
Yeah, thank you, ma'am. There is one more question. Quickly close this. How to improve attention span challenges while online session? The same question, I think.
Same again and again. See, this is
Yeah.
the barrier. This is somewhere we have been perseverant. We have been thinking that online therapy is something different. No, it is not. It is as easy or as difficult with any other child to constantly get the attention. Your resources plays a very important role. You as a speech therapist using yourself as a speech therapy material plays the maximum role.
Okay, there is one more question, ma'am, from Shabana. She's asking how to control vocal or verbal stimming during speech therapy with online session.
Yeah, see, why it's a huge topic. It's like autism, dealing with autism. How do you control it in all offline therapy? Verbal steaming is because the child is constantly saying something out of context. So how do you make it more meaningful? So you, even if the child is blabbering something or using neologisms, what you do is you try to shape his speech therapy behaviors and model what is the appropriate. Same thing in online speech therapy. That's how you do it.
Yeah, and one more question, ma'am. Is Boomcards app a good one to use?
Yes, it is. It is. It is, and I have no, this thing to record it also, that I've used it personally.
Okay.
Whatever the new speech therapists are developing, everybody is doing so remarkable work. No, this really needs a lot of encouragement from all of us. Please use it yourself. You will see. If you need hard copy, Bloom is good. If you need online therapy, Walnut is good. I know them personally, and when I've gone through the training program, no, I have understood. I didn't use because I know them personally. Never do that. Get yourself trained, get satisfied, ask you all your queries, and then start using it. And then eventually you will get more hang to it.
Right. Thank you so much, ma'am. I think we are over with the questions. I think we almost finished. Many participants are saying thank you so much for your answers. Patiently you answered, ma'am, and I think many participants are also satisfied with your answers. If you have any questions, please do send a mail or write to us. Definitely we'll get it answered from madam. She is a member of TESELPA also, right? So thank you, madam, for taking out your valuable time and explaining the importance of teletherapy and the tools and everything. Okay, ma'am.
Thank you so much. Thank you, Walnut team, and thank you, TSLPM. It was an honor. Thank you.
Right. Now let's quickly move on to our session number 2. Now, I would like to invite our guest speaker, Dr. Anima Mishra, madam, who is a leading expert in speech language pathology. Anima madam is a MSLP and Triple C SLP and CAS and also ADHD CRSP. She is nationally and internationally certified in the field of speech language pathology and audiology. And she is a private practitioner and also a school-based SLP. She has over about 14 years of experience in working with individuals with communication impairments, particularly with upper elementary, middle school, and adolescents with autism, attention deficit disorders, learning disabilities, and central auditory processing disorders. She has also supervised and guided bachelor's and master degree students in speech and hearing sciences, and also she has written research papers, developed indigenous assessment tools, and also madam has moved to United States, where she has learned and implemented several evidence-based therapy techniques and earned several certifications for that. She holds certificate of clinical competence from American Speech and Language Hearing Association, and she is also a Asha Ace awardee for excellence in continuing education. She has taken further leaps and earned the credential of Certified Artisan Specialist and Certified ADHD Rehabilitation Service Provider. She is also a Hanen certified as well and provides more than words coaching sessions. She is certified in using prompt, sensory enrichment therapy, PECS, DIR flow time, LSVT loud, all those, and also she's also certified in play therapy for children, and she's a co-founder and director of Walnut Early Supports, which is a web-based digital therapy resource library that houses interventions for areas of speech, language, cognition, social, emotional, behavior domains, along with reading interventions. And also, one special thing is they are having the sex education for the special needs also. That was all about our guest speaker's introduction. And now we request Madam to highlight and shed a light on innovative technologies and the importance of innovative technologies in modern speech language therapy. I'll make you host, Madam. Thank you for joining, Madam. We're happy to have you.
Thank you for this wonderful, wonderful introduction, Dr. Arif. It's a pleasure collaborating with TSLPA and presenting in front of this esteemed audience. I will take insights from my senior and colleague, Arpita ma'am, and then move on with the presentation.
One second, ma'am. Arpita, Madam, can you make me as a host now?
Yes, 1 second.
Yeah. Or else you can directly make Anima Mishra Madam to be a host.
I have done it. I have made you. I've
Okay,
already made you.
okay. Now I'll make Madam. Yeah. Yes, ma'am. Now you are a host now. So you know that's.
Yes, as I was saying, I'll take insights from Arpita ma'am's presentation and move on with special focus on innovative strategies and innovative technology that are available that we know is there, but we just don't know how to use it to the maximum benefit. And my session is going to be more focused for those private practitioners or solo practitioners and how to help them get that grasp over their business and how to move on. Give me 1 second while I share my screen.
Yes, ma'am. No, it's very yeah.
Sorry, is it the screen? I'm just
visible, ma'am. Visible. Screen is visible.
Yes. Okay. So let's start. Let me just. Okay, I'm ready. Okay, so running a successful speech therapy private practice requires a blend of clinical expertise and business acumen, strategic marketing and planning, while delivering high quality therapy services is the core of your practice. Continuously improving and expanding your business is essential to stand out in a competitive field. We all know that. It is nothing new that I'm going to tell you today. We're just going to do a refresher of everything that you've been doing as accomplished therapist and then more. Let's focus on clinical expertise for a bit. Improving clinical expertise is an ongoing process that requires dedication to learning, reflection, and practical experience. Everyone in this room is an expert. I will not undermine your expertise by telling you what to do and what not to do. However, just as a refresher, as I said, here's a brief overview of the process, things that we need to do to be able to keeping up with our clinical expertise. Next, move on to business acumen. Improving business acumen is essential for growing a successful practice, especially in fields like speech pathology or autism therapy, where balancing clinical skills and business management can lead to greater impact and sustainability. First and foremost is financial literacy. Financial literacy just does not mean knowing profit and losses and budgeting. It also means how to know to read a balance sheet, how to read income statements, how to read cash flow statements, and arrive at a sweet price point. Another important thing that I'm always asked of, or as a private practitioner, when I started, always had a conflict: service for free versus service for a fee. Now, service for free and service for fee, both of these are critical components of expanding any private practice. Free services can be a powerful marketing tool and help in building trust, while charging for services ensures financial sustainability and reinforces the value of your expertise. Finding the right balance between the two will help you grow your practice while maintaining your professional integrity. Another aspect that I see that newcomers or people who are just setting up their clinical or private practice lack is the legal and regulatory knowledge. This is very, very crucial. You need to know about licensing, insurance, compliance with telepractice regulations, and also need to have a strong understanding of contracts, client agreements, staff or employee contracts, and vendor partnerships. Last but not the least, the most robust strategy is a referral networking. The mantra is very simple here: refer and get referred. Next, moving on to strategic marketing and planning. Set clear goals, define short-term and long-term goals. If needed, write your mission and vision statements. Do your market research. Know your competitors, know your clients' needs and industry trends. And be ready for risk management. Like, this term, risk management, was literally non-existent in this field of speech pathology and audiology until the pandemic, COVID-19, hit us. We all scrambled. We didn't know what needed to be done then. But now that we have gone through that, we need to be ready. So certain things that you need to ask yourselves include: do you have a backup plan when the client goes remote for an unprecedented amount of time? Do you offer home training programs? How do you monitor progress when it is, home training? How do you do parent coaching, or do you offer parent coaching programs? How do you monitor efficiency in parent coaching? These are certain questions that you need to write down as a practitioner and arrive at an answer should there be a risk or disaster situation. Next is digital marketing. Now, well, everybody is familiar with the term, out of sight, out of mind. So do not be out of sight. Invest in learning digital marketing skills. Invest in learning social media marketing skills. Invest in a good and a robust email marketing tool. There are several email marketing tools available. Constant Contact or Flowdesk. These are certain things that are available within budget. These tools can help you reach a larger audience, build an online presence that attracts new clients. You can use your dedicated clinic email ID to send, multiple emails in a month, maybe once a month, with tips and tricks to the clients. Or if you're a little bit more fancy and can afford that extra cash, go for a short and simple website. And trust me, ChatGPT is going to come in very handy when you're sending these emails. Moving on. The most important thing that we need to remember or work on is client retention strategies. Apart from your clinical expertise, implement strategies to retain clients, such as personalized follow-ups, loyalty programs like pay for 10 sessions in advance and get 3 sessions or 2 sessions free, regular check-ins, customized plans, additional services like an occupational therapist or physical therapist in your clinic, and use of innovative technology to offer innovative problem solving. Now, this will help you maximize benefits of therapy, show faster results, get you good reviews, and lead to more organic referrals. The next point is unique selling proposition, as it is otherwise known as USP. It is the essence of what makes your product or service better than competitors. Now, here, I would like to ask the audience if they are, comfortable in answering this question or just typing in chat. What do they think their USP is? Are you an autism special clinic? Are you into telepractice? Are you a clinic that promotes and supports AAC implementation? Are you specialized in neurotherapy? Do you have an ABA support in your clinic? Do you have a physical therapist support? Do you have a OT support? Do you have a special educator support? What is your USP? What separates you from your competitors? Why would I refer a client to you? Anybody? What do you think? Or let's say in 2024, what you think should be your USP? Let me tell you, in 2024, your USP should be using new and innovative technology effectively to maximize your potential and lead to growth. We have seen all of these on my screen. All clients, all parents are aware these are the supports they get. They get it in every other clinic. But you can maximize the benefits just by going innovative. Now, again, there are various advantages. Technology will help you recognize new possibilities that you've never thought you could do. Like listening to Arpita ma'am, you can say that there are certain things that you didn't know you could do, like, doing an online or motor evaluation during a teletherapy session. So recognizing new possibilities, organizing your available resources to transform those possibilities into products and processes, and sustaining clinical activities at a larger scale. In my physical or in-person session, if I'm able to see 5 clients in a day, through teletherapy, I can work extended hours. I can have 2 more additional therapies. I can use more innovative strategies and technologies and, go on larger scale. Technology in 2024 has the ability to disrupt market. It will lead to significant advancement in your performance and radically improve your standards of living. Gone are those days when parents walked into speech therapy clinics and found the speech pathologist on the floor playing with toys, and they always almost thought that these people are just playing with my child. Or gone are those days when people saw audiologists sitting behind a fancy screen and fancy suit in an AC chamber working with laptops and high-tech instruments. Today, along with digital tools, AI, machine learning, virtual reality, and wearable technology, speech-language therapy has become high-tech and stress-free. The landscape of therapy has seen significant changes over the last few decades. Incorporating technology into your practice can significantly improve your efficiency and client engagement. So if you see my screen, you can see there are 3 different avenues where you can actually use technology. One is using a teletherapy interface, then practice management software, and the third one is digital therapy materials. So when I say a teletherapy interface, I mean an interface like Zoom, or in the US, what I have to use is a HIPAA compliant platform. And HIPAA is here the privacy laws, so HIPAA compliant platform. Now, always remember to take a subscription. I know you may not like shelling those extra, few hundred or thousand rupees on it, but go ahead, trust me, do not trust on free meetings or the 45 minutes stuff that Google or Zoom offers. Get a subscription for yourself. The next one is practice management software. Use a tool for billing, use a tool for scheduling, use something like SLP Toolkit. It's very affordable and fancy. And then digital therapy materials. Of course, we've heard about Walnut, and we're going to learn more as we go on. But Walnut brings you indigenous materials which are more apt for Indian context. And trust me, they don't burn a hole in your pocket. Moving on. Using innovative technology or using the existing technology innovatively. Now, I am someone who uses a little bit of both, more so latter. Who has all the money to buy the latest technology? So why not use what you have? So let's see a mixture of both. There's certain things, elements in this presentation that as professionals, you're already aware about, and certain elements that I will share with you that I can see that is in practice over here in the States. First one is a speech generating devices. These are AAC devices, high-tech devices. We're aware about Avaz, Tobii Dynavox, and there's so many free apps that can be used. Now, when we talk about AAC devices, we all have this kind of narrow vision that these are supposed to be used by non-speaking or non-verbal kids. Let me tell you this. No, you can use these devices with your verbal or speaking children. Now, an iPad in front of them or an app on the phone is always more fascinating and always more engaging to kids instead of just having to go back and forth with the traditional therapy material and working the normal way. Now, if you look at this video, let me play it. Can you hear the sound? Is the audio,
Yeah,
is the audio
audio is audible, ma'am. Audible. Yeah, please, you can play.
great?
Yes,
So to-
puddle. Blank, blank. Oh, no. You're very gestural today, aren't you? No, no,
Like, oh no, what a mess. I think we should dry him. Let's see if we can get him dried off. He's so wet. Who can help me? Oh, yeah, you can help. Oh, hi. Oh, I see it.
No.
Yeah.
Look, do you see
that?
Do you want me to show you? Look, do you want to help?
Yeah.
Dry?
So in this video, if you saw that this is the group session where there are a mixture of devices being used by kids. Somebody is using a button that's a low-tech AAC device, somebody using an iPad, and there's a speaking child too, who is also using an iPad. It is always exciting for kids to use an iPad or a AAC device to add on to their utterances, to increase their mean length of utterance. In this slide, you can see this is a child with cerebral palsy. She is 5.5, and she is using a button device. This is a Big Mac that she's using here. Let me play this one for you. Okay, I don't think this is working. Anyways, so let me share with you now. There are several tools available in the market. So the picture is one such device that's available freely. I mean, not freely, of course, for budget price in Amazon, which is a kind of a small talker, which parents can take with themselves to therapy outside, in a park, not inside a room. They can take it to a restaurant. You as a clinician, if you don't want to use an expensive iPad in your session for a child because you don't know how they will deal with it, how they will manage it, use something very simple like that. Or I have these buttons over here. These are very budget, simple buttons that are available online for cheap, and these record messages. So let's hear it. Drink water. So this one said, drink water. Watch TV. Watch TV. Open. Play ball. And then I have so many more that I use on a very, very regular basis. If I see the child doesn't want to sit for a device, is not ready for a device, this is what I do. So now a button like this can be put on Velcro and fixed in front of a bathroom door. So every time the child wants to go to a bathroom, he can press on it and say, open. Or something like this can be put near the TV, where when the child wants to watch a TV, can press watch TV or drink water. Now, this is something that you can offer your clients for the fee. You don't have to give it to them for free. You can just give it to them for a fee. And then when they're outgrowing this, these are recordable buttons that can be used to record and re-record messages. These can be used for our GLP or Gestalt language processes because it can record their entire Gestalts. So these buttons are very, very used. They are all very budget buttons that can be used and very, very useful. Let's see something little bit more high-tech. Now, here is an interactive whiteboard. So the best thing about interactive whiteboards are that you can use these for conducting group therapy sessions. You just don't need to have a single device and sit on a desk with a child and use the materials. This can be used to cast your screen from your laptop, and multiple kids can use it at the same time. Let me try to play this video for you. Now, this is a 7-year-old client, AJ, with level 3 autism and situational mutism. He is non-speaking for most part of the day, however, is hyperlexic and can read. He speaks when he desires to. So this is the glimpse of a session when I was working with him on hyperlexia and using sequencing cards from Walnut's digital library.
Good job, baby. Click what happens first. Good job.
Now for this kid, I've struggled many a times having him to sit down and work with me. He is very, very sensory seeking. He's always on the go. Either he's on the trampoline in my office or sitting on a gym ball. But the moment I started introducing these digital materials on my big screen, that's what drew his attention. And that's how I got him to work. And mind you, because he's hyperlexic, he can read the direction by himself. And if with a little bit of assistance, we can move forward working with him. Next one is articulation apps. Now, all of us know there's so many apps on iOS or Android platforms that give us very good, useful material pictures, but very few of them actually are relevant when it comes to using or showing placements. Now, the first one, when you really look for materials, Articulation Station is a great app for keeping kids engaged. But if you really want to show placement to children and adults, which I usually use extensively with cleft or dysarthria clients, this is the one you must try, Tools for Clear Speech. So if you look at the screen, you can see it shows it shows the palatal movements, where the palate rises and how it rises. It shows about the tongue elevation and depression. It shows the quantity or amount of mouth opening, the oral constriction, and the likes. For voice and fluency, again, there are so many apps that can be used. One of my favorites is TalkMe. I'm not sure if you can read clearly from my screen, but this is from a stuttering client who is very shy and embarrassed of his fluency and likes to practice all by himself. He lives by himself, so he doesn't, have a company to talk and practice. So this AI gives you situations and asks you questions. You can answer it back. If it understands you, you're doing good. If it doesn't, it will give you a feedback. So I do not have the video for this, but if you can look at my screen, the screen says, welcome to our cafe. What type of coffee are you in the mood for today? And my client here says, I want black coffee. He uses modified airflow technique. So he was using the technique while he was doing it. And next he says, the app says, great choice. Would you like it hot or iced today? And my client says, I want iced coffee. Moving on, now ChatGPT is the trending tool, the talk of the town, and this is the ChatGPT screenshot that has been used for one of my clients to practice a park conversation scene. The client is in a park and ChatGPT kind of asks questions, relevant questions, and there's a back and forth interaction here. This is the verbal, the transcript of it. But what I will do is I will share you a live recording of a session of me interacting with ChatGPT. So let's see, this is a situation where me and ChatGPT, we are in conversation with each other and pretending we are sitting in a cafe.
Hello, can we have a conversation about sitting in a cafeteria?
Sure. What would you like to talk about regarding sitting in a cafeteria?
So that was my prompt. That was the prompt that I gave to ChatGPT. Let's see how the rest of the conversation goes.
Maybe something about the social experience, the atmosphere, or even specific memories.
Hi, I see you're sitting here alone. Can I join you?
Oh, hey, sure. Feel free to join me. How's your day going so far?
My day is going slow. I'm here just to relax. How about you?
I get that. Sometimes a slow day is just what we need, though. I'm here to just unwind too. Grab a bite and watch people go by. What's on your mind while you're relaxing?
I'm just thinking how to plan my rest of the day.
That's a good idea. Do you have anything specific you're considering, or are you just letting the day take you wherever it goes?
I guess I'm letting the day take me wherever it goes, but I definitely have some list that I need to accomplish.
So if you just heard that conversation, it appeared so natural and so lively. So for my clients, mostly the teenagers, the adults and the adolescents who are embarrassed of getting into conversation and practicing their strategy with a stranger, or even with immediate family members, they don't have a safe environment to do that. This is a great tool that I use. From practicing social situations to interview-based questions and specific topics. If there's an anxiety-provoking situation I know that client is going to face, engage him with ChatGPT. It's going to give you that context and have that back and forth interaction. It is not going to make you look very artificial when you're trying to mimic it in your personal therapy session. Moving on. Speech recognition softwares like voice typing tools with my clients who have writing or language impairments or motor impairments. This is what I use. Google's voice typing or Microsoft dictation is very, very handy and helpful. And trust me when I say this, the majority of this presentation was written hands-free using MS Dictation while I enjoyed my tea and biscuits. Next is virtual reality. If you remember, just taking a little step further from this presentation and going back to Arpita's presentation, she did talk about augmented reality and virtual reality. Go take a look for yourself in ASHA website and different, evidence-based research papers that have been published on use of VR and use of augmented reality on how they have been advantageous and helpful in simulating real life situations, ordering food in a cafeteria or any other social situations. These are very, very helpful with teenagers and adults. They require a heavy investment for sure, but if your client is a gamer and interested in something like that, let them push them for it, let them go forward for it. But if you are looking for something that is free and easily accessible, go for Google Expedition and Google Arts and Culture. That's what I use. Moving on. Again, for augmented reality, what I love to use is Quiver and Osmo. Now, they bring digital objects layer over the real world, and they add this beautiful sensory dimension to learning. And a lot of my kids just love Quiver, and it gives a very spontaneous burst of conversation. Chatbots and virtual assistants, we are not shy of knowing the abilities of our Siri, Alexa, and Google Home. So use those to the maximum benefits, give them prompts, let your clients engage let them record an engagement session with those virtual assistants and send you back. Once they send you back, you can analyze the sample. You can see if they've used their strategies. You can see they've not, they're doing something incorrectly. All of that can be done. These are just some, additional ways in which you can be into their homes, into their lives and monitoring them, even though they are seeing you virtually or in person, maybe just once a week or, once in 15 days. Moving on, wearable technology. Now, this is something new. Lena or Mightier devices, they are small box kind of devices that are worn on a child's body. And these devices collect speech patterns and speech sample from the child's language environment. They can analyze patterns, tones, stress levels, and they give a great feedback for therapists as well as parents to know which areas actually need attention. A pocket-friendly version can be a smartphone. So ask your parents to put a smartphone on without recording, or even a nanny cam on, and record the child's language environment, not just 10 minutes of planned interactive sessions. Ask them for at least 30 minutes of session. Just put it on during breakfast time. Let's see how it goes. Put it on during a bath time, or put it on during a travel when you're taking a trip in the car. Let's analyze the sample, listen to how much content words are there. What are the functional words being used? Are the parents or adults gossiping or chatting amongst themselves? Is the child still using it, just left alone? What kind of words, or what's the intonation pattern? What's the rhythm? And show the analysis to the parents. Tell them where exactly they're lacking. Show your expertise and add to it. Use your friendly strategies, expansion, extension, your self-talk, parallel talk, just a little bit in an innovative way. Moving on to wearable technology, like wearable bracelets. There are sensory bracelets available, which can vibrate and give sensory and calming effects to clients with sensory needs. Another good way that I use for myself, like while being here, if you saw me taking a sip of water, I got a reminder on my watch, drink water. So some similar tools that are there on Android and iOS app stores are Breathe Well Wear, or I think this one I use is for water. So Remind apps are there, which can actually be customized for your persons or clients with stuttering to take a deep breath, to reduce their rate of speech, and use strategy. So when you start monitoring, when you start micromanaging a little bit more, you get that efficiency out of your client. You get that faster, recovery, or for the lack of good word, better progress in your client, and it leads to client retention. Moving on, interactive robots. Now, these are the talk of the town here, I'll tell you. Milo and Casper are robots designed for children with autism to practice social skills, their speech and emotional regulation skills. These robots help in mimicking situations that children are familiar with. They help in back and forth practice of answers. And the best thing about these robots are that they are not unpredictable like human interaction. We know that kids or individuals, artistic individuals, thrive on predictability. These robots are predictable. Now, there are various such budget robots available in the market. Now, again, you can use those for emotional regulations because their budget, they will not be AI installed. So they will not be able to initiate or maintain a conversation with your client, but they can be used for emotional regulation and to enhance speech. Moving on, gamification or reward-based learning. Now, in the chat box, I saw there were several questions about people asking about what apps to use. Now, apps are gamified. Apps are reward-based learning. But as professionals, and as Arpita ma'am repeatedly said, you know the best for your clients. You need to know which app is supposed to be used and what is not supposed to be used. Now, I'll tell you why. Because although there are several of these apps, there exists a huge gap in what these apps can offer in general versus what these apps offer to the Indian audience. Majority of these apps are not developed by Indian SLPs or SLPs per se. They do not know the Indian market. They do not know the kind of festivities we have, or the kind of food we eat, the kind of context we go through. That's one. The second thing is these apps are very, very, very expensive. Many of these are not available. The good ones especially are not available in the Indian market, and they only solve one kind of problem. Either you can download an app for articulation or an app for language or a separate one for fluency. And I understand, coming from a background of having a private practice, it is not going to be easy to afford so many different apps. And on top of that, to convince parents to go and buy the same ones to practice at home. And another question that I saw was, what if the child gets addicted to the screen, addicted to the screen in these apps? Well, yes, these apps are designed to make addiction into children. They have bizarre graphics, they have constant sounds, automated levels. These are addictive. But where is your role then? It minimizes these apps, they minimize your role as a therapist, they minimize the parent's role, they minimize the role of a facilitator, they interrupt the flow of the teaching, they interrupt a reinforcement, they interrupt reinforcing a concept or repetitive practice, because a child knows if I click next, I can't go back. So where is the scope for you to stop and pause and teach the concept? So for that, what you need to do is not gamify, but work on reward-based learning. Now, what if I told you that all of these problems have been resolved for you? Walnut Early Supports has designed reward-based learning systems that are designed not to create dependency or addiction. With minimal graphics and sound effects, it is made just to mimic your in-person therapy sessions. Let's look at a little bit of design and concept here. Now, the pandemic taught us well that there's a need for something additional that our practices are missing. So when we take ourselves into people's homes and use the same material in person, we save. And saving means a lot if you're a solo or private practitioner. The more you save, the more you invest or reinvest the money into your practice, do a new certification, do a new course, and gain out of it. Now, all these therapy materials have a lifespan. We know they have a shelf life. We lose a missing piece from a puzzle set, then it's not usable. We have to replace it, which is again very difficult. We have to replace the entire set, or they tear. There's hygiene issues. But what the team behind Walnut has done, they have solved all of these problems for you. Now, please understand, this was designed for the SLPs by the SLPs. Everybody in the core team is a qualified speech language pathologist. And we thrive on diversifying our materials, making interactive and engaging activities, making something that makes tracking progress easier. And of course, they're multisensory, because your client is just not looking, they're touching, and they're making sure that they're engaged actively, just like they would do in your private or in-person therapy session. The user interface is very clean and easy to navigate, even for individuals with or without cognitive or neuromotor impairments. It is accessible. There are alternative input methods for users with motor or cognitive challenges. They can use a touchpad, mouse, their touch screens, a joystick, or even plug in their high-tech AAC device. Depending on the dexterity, they can also just show and trace the path, and the facilitator can navigate. It's bright, friendly colors and engaging graphics, and we are very, very mindful of sensory sensitivities. So our designs have been adjusted in a way to not overstimulate our clients. Moving on. Now, everything in this world is moving towards cloud. We don't even have, you don't even use a pen drive or a hard drive anymore. Everybody uses cloud storage. So all our materials are available in the cloud and available at one click, one time, anywhere, even on the go, on the route to a wedding, on the route to a conference. You have it without the stress of having to prep enough for your sessions. We have cross-platform compatibility. That means these can be used in a mobile device, in an iPad or a tablet, as well as a big screen or a or a desktop. And the most important thing that our materials take into consideration are, in a huge country like India, where there are people of diverse background and diverse cultural linguistic differences, our materials are language barrier-free. They are picture-based and language barrier-free. If you are someone who can log into your laptop or iPad, check email, scroll around mindlessly on Facebook or Instagram, you know how to use Walnut therapy materials. And this is what parents need to do. This is what is going to be your USP. When you tell parents, now, this is what I do my session, and you go back home and you practice the same thing and come back. So from 8 sessions, you are benefiting or showing the progress in half the time. That's where you retain the client. That's where people don't think, oh my God, what's this therapist doing? I'll, shop around. That's where you retain your client. Most importantly, we have, a cute looking themes for our little friends. They all love it. I'll show you some of those. Moving on. Again, as a private practitioner, I said, from the inception of a client into therapy or concept building, for repetitive practice, go on to generalization, transfer, and maintenance. You will not find anything that you already have that can be used at all of these 5 stages of client, participation in therapy. The materials that you use for inception or concept building do not work well for repetitive practice. They do not work well for generalization or transfer or maintenance. Now, we've accomplished that in just one website. No more scrambling for materials. Everything across several sources has been, across several modules or skill sets have been developed for you, where you're not stressed about printing or creating your materials and printing again and again and losing the materials. And all of these are evidence-based. We have a robust team that has spent years together. If you heard me right, yes, years, at least 2.5 years in building these materials and using in the clinical practice, using it with clients across all ages, all disorders, all populations, and then delivering you the best of the products. Now, these are the several modules that Walnut provides. We have about 3,000 plus extensive materials in our library. Just, whenever you have a time, just take a look. For the aware, let me tell you, our module on sex education for the special needs is absolutely available for free for you to download and print and use it in your clinical practice. It is available in Hindi and English, and there's a blank representation where you can use any language your client speaks. And this has been one of the most widely used material that are special schools or older individuals, adolescents who go through these pubertal changes or intimacy issues have been using. Moving on. Now, the language module has about 32 skill areas across both receptive and expressive domains, designed from all stages of inception and dismissal from therapy. You can also use this to continue to provide support to your client after. Let me show you a small, quick game. Again, every stage of this game, you can stop, you can give inputs. It is you who is facilitating. It is not something that will work on its own. The client cannot move forward without your specialized intervention here. So this is a very engaging game. It's a cause and effect game where the kids are required to answer reasoning questions. And guess what? It can also be used with adults having cognitive communicative disorders. You can also work on picture description using this. You can work on answering WH questions and many more. So let's take a look. So this is where you give your cues. This is where you talk to the client. This is where you interact. Without you doing it, nothing is going to move forward. So for example, in this slide, although the task is designed to ask, reasoning questions, I can always ask, what do you see on the plate? What else is there on the plate? What colors chilies do you see? Where are the chilies? And I can address so many other skills as well. Now, this is a snippet from
for the preposition section. And remember, when I said preposition, it has both receptive and expressive prepositions. So let me just scroll down and you will be amazed to see how many different kind of tasks you have in this one filter. And each of these tabs that you see in front of you have at least 20 to 40 type of different questions to practice. So if I just have to work on the top 3 rows that you see for under, I'm getting about 60 to 100 repetitions of the task, which is nearly impossible if you were to purchase preposition card for having under, just one concept under to practice. So let's take a scroll down and see. So you've got different basic concepts, and then you've got expressive prepositions, which are gamified, where kids are not bored behind, flashcard type activities. You've got receptive prepositions, again, when they are selecting a correct answer and whatnot. And it is never ending. And mind you, I usually use one of these, and during my entire session, it takes me about 2 to 3 sessions to just get through one of these games, because there's so many skills that I can address. There's so many things that I can talk about. I can just not the prepositions. I can also ask about the colors of the things, other WH questions, where, what is, and why questions, and how questions, and picture descriptions, and target a lot of other concepts as well. For
Moving on. Now, this is again our following direction games.
Following directions game, where in you will see 2-step directions. So on the panel that's in orange below, there are questions. Circle the dog and touch your nose. So this adult or your client, whoever it is, has to just drag and drop the circle over the dog and then touch their nose. The next direction here is cross the cat and clap your hand. So they have to cross the cat and clap their hands. And just not these two, just based on this particular slide, I can decide to put the X, the cross and the circle back to its place and give my own commands. I can say, well, circle the elephant and circle the tiger. I can also use this 2-step direction just to follow single step, like put the tick on the tiger. So, and there are about 20 such slides in this particular game. And that gives us numerous combinations, which is practically going to be impossible for someone if they're planning to buy materials from any sources, physical materials, print materials, manipulate objects. It is not going to be easy to get to this level of repetition and to be prepped and ready every day with a new different material. And also, let me remind you, instead of just working on following direction questions in this particular game, you can work on asking and answering basic questions like, what colors do you see on the rainbow? Or when does moon come? Is it day or night? Or what color is the sun? Or how many stars do you see in the sky? Just the concept of adjectives like many or little or less or more. And you can innovate. You can innovate and grow with these materials as a speech pathologist.
Let's move on to the next section. This is the cognition section. Now, again, a lot of therapists do not feel comfortable in using or practicing cognition into their private practices because of the lack of materials. Now, everything you see in this section can be used with clients, adults or children with dementia, aphasia, dysarthria, or older kids with autism, ADHD, dyslexia, or Down syndrome. For an adult, the most important thing after a stroke is to be able to get back to work. So they need to know those mathematical computation. They need to know the money concept. They need to be able to, tell time. These are the 3 most critical things that we have addressed during this, section. And I will show you a small snippet of how this is done as well. This is just one game in the section. There are multiple such games, at least 400 to 500 in each of the sections. So this is a reaction time game where the client has to click on the object that moved first. So 43 seconds. So it is timed as 45 seconds. So the client, when they clicked, they did it in the first 2 seconds. So it shows the reaction time that is desirable. Moving on to reading intervention. Again, this is another area where I believe SLPs have not been trained well enough. No one in my knowledge practices reading intervention in their private or clinic. So from start to finish, if you have a school-age client, you can provide holistic interventions using this platform. So this is an initial sound deletion game where the child gets to feed the hungry animal, make it grow, and while making it grow and enjoying the graphics, answer some questions like say B without B, which is ig, or say apple without A, which is pill. So this is how you can, as SLPs, lay foundation for reading and writing. You don't have to refer your client to another person or rely on special educators for additional support. Now, phonological awareness is in your scope of practice, so jump right into it. This is a syllable segmentation game where,
now I want to add a crooked smile, so I go click the smile, and the task here is listen to the word and clap for each syllable you hear, that is rooster. I clap twice and click yes,
and that's how you do the game. So several segments, as I shared, all of those skills that are required for establishing basic reading skills are available here. Now, this is a session where I am working with a 7-year-old level 1 autistic client with hyperlexia. We are working on listening comprehension, reading comprehension, answering WH questions, and picture description. Let's take this. And this is how I use digital materials in my in-person session. This is a group session. There are other kids around, but mind you, it is not just teletherapy. You can use Walnut's material in group sessions as well.
Yes, come on, let's read it together. Jay and Lily are going to Dubai today. They will meet their friends in Dubai. Jay and Lily are very happy. Where are they going, Araz?
Into a flight airplane.
Well, that's right. They're going in a flight, but where are they going? Is there a place in there?
No. Yeah.
Where is the place question? So which place are they going?
Airplane.
They are going in the airplane. They're going to Dubai. Dubai is a place.
Oh.
And who will they meet there?
The pilot.
Well, that's right. They'll meet the pilot in the airplane, but who will they meet in Dubai? The answer is right there. Let's take a look.
The people.
Which people? Is it family? Is it friends? Who will they meet there in Dubai?
Family?
Let's look again. Friends. That's right. Go click next.
Moving on to the next module, that is social emotional behavioral modules. And this module is abundantly full with social stories, which have been made interactive so that you know how your clients are responding to it. We have problem solving, conflict resolution, prediction, conversation starters, and a lot of other activities to target social skills and behavioral skills, not just in children, not just in teenagers, but in grown-ups as well. And this is our final section, which is sex education. As I already said, these are the different kind of materials that are there. And this information particularly has been developed by Aish as a project. And they have been extremely gracious. Project Raksha has been extremely gracious in granting access to Walnut, so that we can all work together on spreading, sex education and intimacy hygiene in our disabled population. So again, summarizing everything all in all, we know that speech, language, and communication skills are linked to educational attainment and future employment prospects. So the ability to play a full role in society and form lasting friendships and relationships depends on you SLPs. And we all know that we have this holistic role in holistic development of an individual. So what makes this easier is using technology to best of its abilities. What makes it easier is to emphasize on the importance of repetitive practice, emphasize on the importance of at-home training, emphasize on the importance of role of parent or facilitator. Use all of these to your advantage. This is going to give you progress in a shorter duration of time. This is going to lead to more client satisfaction. More client satisfaction leads to more organic referrals. And this is how you can grow in your own private practice. I think that is it from my side. I'll hand over to Dr. Arif. This is my contact information. Anything you all need, feel free to send an email or reach out to me on social media or reach out to any of the Walnut handles. And we'll get back to you with your questions or, sorry, with your answers.
Yeah, thank you so much, ma'am. It was a very wonderful and beautiful presentation from you, and I really liked two statements that that was from you. And the first one is service for free and service for fee. That I really like, because even in hearing aid industry also it's like that. Many of offering free services, there the value is coming down. If you charge something, there the value is coming up. So that we all the speech therapists and audiologists need to follow this phenomena. And at the same time, second thing what you highlighted is for the SLPs and by the SLPs. That really like, because see, now you see there are so many other apps or softwares which have been developed by not by the SLPs. So now what I can see, the Walnuts is being developed by SLP by the SLPs. So I really felt happy, and after seeing all those modules and the modules and the activities which you have designed, that's really hats off to you people for developing this software. Especially, you have so many activities in that speech area, language and cognition and reading interactions, and all those really going to help most of our private practitioners, who are doing actively speech therapy in their setups. So thank you so much, madam, for giving your valuable time and developing this such a beautiful app software. I request the participants, if you have any questions. I think we have few questions in the.
Hey, hi, ma'am. Your innovative approach was quite interesting, and but with reference to your modules, I have a doubt. Why are these modules? It is a subscription based. We did talk about a lot of apps. I just wanted to know, why is it subscription based? Thank you, ma'am.
Thank you for your question, Sindhu. So with subscription-based model comes the ability for us to innovate and keep adding more and more materials. If you are familiar with Walnut, you can see we have started adding materials in Malayalam, and now we are working on developing materials in Kannada and Hindi, which will gradually be added. So if it is a one-time fee, it is going to make it difficult for us to keep on updating. So every time you have to purchase a new material, it's going to add to your cost as well. So it is just going to be like something like TPT, where or boom cards, you're spending $5 and buying something and again spending another 5 or 10 or buying. So subscription-based give us the ability to give you access to the entirety of the 3,000 plus materials and plus more.
Thank you. Thank you, ma'am.
Yeah, madam, we have one more question from Namrata. She's asking which device can we access the modules? The modules which you have explained about, to which device do we need to use?
As I shared, we have cross platform compatibility, but I would say these are best used in bigger screens. We would not encourage you to use it in small cell phone screens, anything from a tablet to a laptop or even a smart board.
Okay, and also one more question from Namita. What she's asking is, can these modules used for adults?
Oh, yes. Yes. Our language section has a lot of activities that can be used post a phase A rehabilitation. Our cognition section is designed with adults in mind. Our reading intervention section can also be to reinstate those confident readers post-stroke.
Okay, so we have one more question, ma'am. What if the child's IQ is less, or a condition where they can't use these apps?
So just like your own traditional one-on-one therapy, you have different materials for the ones who are non-ambulatory, different kind of strategies that you use for those kids versus the kids who are ambulatory, running around, speaking and sitting. Same way, there needs to be accommodations for these kids made. We understand, that's why I said our material can be navigated by a joystick or can be connected to an AAC device. If you have a touch screen friendly device, they can touch or they can even point at what they are doing.
And also, there is one more question from Fahiza Parker. What she's asking is it limited for use in India or can be used internationally?
Can be used globally, anywhere.
Okay. Yeah, I think there is one more question from, what about small kid, non-verbal, moderate autistics?
By small, if you're saying under the age of 2, as per guidelines, screen time needs to be limited, but anything that facilitates interaction is not considered as screen time. So if you are using Wallet's material and continuously talking back and forth with the child, these materials can be used and that is not considered as a screen time. Just like talking to grandparents over video chat is not considered screen time, using Wallet for therapy is not considered screen time and can be used for kids as young as 2 years old and with moderate or additional or level 3 impairments.
Yeah, there is one more interesting question. What do we do when parents does not want to expose their kids to screen? How do we convince them?
That is your expertise as a clinician. How do you convince parents to spend some 20 or 30,000 rupees to buy, materials for oral manipulation? You do that, right?
Yeah.
So that's you as a clinician. You have to cite studies. There are several researchers, several studies available. Get it equipped with those. Show parents those podcasts and webinars where experts all across the globe sit together and discuss about the harmful effects of screen time. What counts as screen time, what doesn't. And if you listen to Dr. Arpita, she had some fabulous points who highlighted how to best use screen time to the benefit of the clients and how to convince parents.
Yeah, I think you have covered it nicely. And ma'am, there is one more question from Nitina Alais. What she's asking is there any game or other links or sites to grab small kids' attention for telepractice?
There are several other sites, that I've, to grab kids' attention, just small games also. There are so many other sites which have small games like spinner games or bubble pop games. Those are there, or drawing games. You can just use Microsoft Paint in that sense, right? Or just pull up a random PowerPoint and click and paste just pictures and ask them to drag and manipulate. So there are a lot of other things that can be used as well. But again, I'll just go back and emphasize what Arpita ma'am said, that when you as a clinician want to grow, you have to stop relying on these free services because they can only take you further few steps.
Right. I think Madam has mostly covered almost all the questions. Now we don't have any more questions, I think. So thank you so much, Madam, for patiently answering to all the questions and giving your valuable time and also explaining about what are the recent updated technologies which are very useful for the speech therapy practice. Thank you so much, Madam.
One more thing, Dr. Arif, thank you for this wonderful opportunity, but I just remembered something I should have shared. This is additional bonus from me. This is a DocuCam. This is called as a document cam. Invest in a good one. It is going to come very handy.
Oh, I think if it is available in India, surely
it is. This is available. This should not cost you more than 3,000 to 4,000. So what I do is I connect it to my screen. And if I'm working on writing or drawing something, I put my notebook and start writing. So this exactly reflects into my screen and my child can do the same. And a cost-effective way is to be able to use your own cell phone, a better cell phone stand, connect using the second screen, put the screen down, and whatever you write or whatever you're doing here can be shown on the screen.
So if
you do a craft activity online, this is how you do it together with your child.
Right. Because many learning disability children, they show much interest into this kind of things. Yes.
Yes. That, and also, as I said, if you want to do a craft activity, if you want to, do coloring together with your client in therapy. So it gives you the flexibility to move around a lot of things. I also actually bring toys down here under my table and I play with my toys while my client is giving me directions on what to do. And while on my screen, there's Walnut shared where they're working on preposition under, and they touch under and show, well, put it under, put the ball under the cap, or put the ball under the balloon, things like that. So that's going to come in very handy as well.
And also the buttons, which you have explained about that also, if it is available, I think many
It is available. It is
private
available.
practitioners, they start buying it, I think.
Yes, I have plenty in here. I have like some 20 buttons in here with me that I use.
That cost about how much, madam? Each button cost about?
Not know how much these costs in INR, but they should be affordable because these are affordable here as well.
Okay. Okay. Yeah, I think, thank you so much, ma'am, once again.
You're welcome. Thank you for this
Participants,
wonderful.
if you have any questions, please, you can ask. Now we are almost about to close this. So I think there are no more questions. So now I would like to call upon Dr. Pragati Shatapathy. She is also the co-founder of Walnut Early Supports. I request her to say a vote of thanks.
Thank you, Dr. Arif. Good evening, one and all. I feel really honored and privileged to get the opportunity to deliver the vote of thanks on this special occasion. I would like to thank all the honorable attendees for your presence. I am also very much thankful to all the program advisory committee members and the invited speakers. Words are not enough to thank their constant guidance and support to shape this webinar. I, Dr. Pragati Shatapathy, on behalf of Walnut Early Supports, convey my deep regards and hearty thanks to our speakers, Dr. Arpita Chatterjee Shahi and Dr. Anima Mishra. I am also thankful to Telangana Audiologists and Speech Language Pathologists Association, TASLPA, especially to Dr. Nagendra Kankipati, founder and president TASLPA, Dr. Imad Khan Ruman, founder and general secretary TASLPA, Dr. Arif Sheikh, moderator and treasurer TASLPA, Dr. Rajendra Kumar P, advisor TASLPA. They have helped us in obtaining the necessary arrangements for the event. They have supported in all possible manners to organize this webinar and Walnut Early Supports. My special thanks to Dr. Arif Sheikh for various help we received towards this webinar. If time is money, then today you all have spent millions for us. Thanks to all of you for making this webinar successful. Thank you so much for attending, and thank you TASLPA team to promoting Walnut Early Supports. Thank you so much. Good night.
Thank you. Thank you so much, ma'am. We're always there for our people, especially our audiology, our speech language pathology fraternity. We're always there to support SLPI is like, always doing some kind of activities. And whenever somebody is coming with this kind of innovative technologies, definitely will support. We have our TESLPA president, Dr. Nagendra Kankipati, sir. If you have anything to add, please, you can talk, sir.
Yeah. Thank you so much, Dr. Arif ji, for arranging this wonderful webinar. I congratulate both the speakers, Dr. Arpita Madam and Dr. Anima Mishra Madam, for enlightening all of us about the latest innovative technologies in SLPs. Definitely, it will boost all our private practice. And both have highlighted very well about the telepractice and as well as the various apps which are used for the speech therapy. I really gone through the Walnut website also. It is very wonderfully designed. The modules are very good. Definitely, we will promote your website, madam. And here we can see still the participant number is minimum 50 members are there. This is the first ever webinar we are seeing with 75% of the attendance till the end of the session. Very well. I congratulate all our honorable members for joining this webinar and making this grand success. Thank you so much.
Thank you, sir. Thank you so much for giving your valuable time and trusting me. I think thank you so much again to all our participants for patiently listening to our guest speakers. I request all of you to please go through this Walnut website and you have beautiful, wonderful materials, modules, through which you can give some kind of benefit to your patients. We have our advisor also, Dr. Rajendra Porika sir. I request you to say a few words.
Yes, I'm audible, doctor.
Yeah, audible, sir.
Yeah. First of all, I congratulate all the resource persons. Both of them have given excellent what is required nowadays, like on online platform, digital utilization of various apps. This gives enlightenment to our participants. Definitely the end user, such as the patients and the parents, importantly, will be having the idea how to move on, and SLPs will take certain measures that what need to be considered and how one should deal without any fear in their routine job like therapeutics when you are handling special children or children with communication disorders. And in this regard, I would like to thank all our team members and particularly the Walnut staff and Dr. Arif for making this program very good initiative and successfully conducting it. It is not easy. Now today I could see myself in you while doing the moderation work. Very happy to be like that and taking the roles in appropriate manner. And definitely TUSSLPA and UCA are the, as madam said just before, are the active what we call associations where we respect all the ASLPs as doctors and means professionals with updated knowledge. So that is what required, and dissemination of knowledge, and definitely for therapeutics and audiological services in rehabilitation programs. Thank you once again. Thank you all.
Thank you, ma'am. With this note, I think we are going to close the webinar. Thank you so much, madam, especially to our Walnut early supports and the guest speakers, and also to the participants. Now we're going to close this session. Thank you.
Thank you.
Thank you.